Do you or someone in your family have trouble cleaning themselves after using the bathroom? Have you ever felt the frustration of needing help during such private moments? This situation is more common than it seems, and it can deeply affect one's self-esteem and sense of independence. In this video, you'll learn simple, practical, and accessible techniques that help with intimate hygiene even when physical limitations are present. These are solutions specially designed for older adults who deal with pain, lack of mobility, or difficulty bending, reaching, or handling objects. If you're a caregiver or someone looking for more independence in your daily routine, watch until the end. You'll see that, with a few adjustments, it's possible to regain confidence, comfort, and dignity, starting with something as essential as personal hygiene. And if this topic resonates with you, go ahead and give it a like and subscribe to the channel to keep receiving content that supports your health, well-being, and freedom every day. For many people, cleaning up after using the bathroom is a simple, almost automatic task. But as the body ages, this everyday action can become a real challenge. Reduced flexibility, joint pain, loss of balance, and decreased strength in the arms or legs are just some of the obstacles millions of elderly people face every day. Difficulty cleaning properly affects more than just the body. It impacts self-esteem, dignity, and the sense of independence. Many people avoid talking about it, feel embarrassed to ask for help, or worse, resign themselves to discomfort out of fear of being a burden. And this reality doesn't affect only those who are aging. Caregivers, children, and family members also face the dilemma of how to help without intruding, how to guide without embarrassing. Ignoring this challenge can lead to more serious problems: infections, rashes, bad odors, skin irritation, and over time, even depression caused by the loss of autonomy. The simple act of staying clean and comfortable is, in fact, a fundamental pillar of physical, emotional, and social well-being in old age. That's why, in this video, our focus goes beyond cleanliness. We're talking about autonomy, comfort, and respect. You'll discover real and accessible solutions to a silent yet deeply human problem. Because no one should have to give up their dignity, especially not during the most intimate moments of the day. Now that you better understand the challenges of hygiene, it's time to explore the solutions that truly make a difference, starting with assistive tools. Have you heard of long-handled hygiene wands? These tools were designed specifically to make it easier to reach intimate areas without needing to bend over or strain the arms. They're lightweight, ergonomic, and can be used with toilet paper or wet wipes, perfect for those with limited mobility, shoulders, spine, or hips. Small adjustments like these eliminate unnecessary pain and bring more independence to daily life, something essential for physical and emotional well-being. Another powerful ally is the portable bidet, a small bottle with a directional nozzle that allows effective cleaning using only water. It's lightweight, discreet, and can be used directly in the toilet. For those who avoid fixed bidet sprayers or don't have the right bathroom setup, this is a practical and accessible alternative. What's more, it requires no installation or modification, making it easy for either the caregiver or the person themselves to use it right away. There are also adapted toilet paper holders that keep the roll within easy reach, eliminating the need for twisting motions. This prevents falls, dangerous strains, and even discomfort in the shoulders and back. Often, what causes a loss of balance or risk of accidents are these seemingly simple movements that are poorly distributed across the body. Having the paper within reach, at the right height, might seem like a small detail, but it's a detail that offers protection. And if the elderly person has any urinary or fecal incontinence, neutral wet wipes can be great allies. But a word of caution: always choose alcohol-free and fragrance-free versions to protect the delicate skin of the intimate area. In addition to ensuring more effective hygiene, they help prevent rashes, itching, and infections, common in cases of constant moisture or improper cleaning. The best part? All of these items are easily accessible, don't require complicated installation or high investment. Often just one or two of these tools can bring significant changes to a person's routine. It's a simple step, but one that restores something much greater: the feeling of autonomy, comfort, and safety in one's own body. Because more than just tools, these aids represent freedom, and in this context, freedom is also dignity. Beyond the tools that assist with hygiene, The way the body moves during these moments is crucial for ensuring safety and avoiding pain. Many falls and injuries happen in the bathroom due to incorrect movements, imbalance, or excessive strain. That's why paying attention to posture and adapting movements is just as important as choosing the right accessories. The first practical tip involves positioning on the toilet seat. For those who struggle to sit down or get up, a raised toilet seat can make a huge difference. It reduces the degree of knee and hip flexion, lessening the required effort and preventing strain on the joints. People with arthritis, lower back pain, or muscle weakness benefit almost immediately from this change. If a raised seat isn't available, installing a side support bar is an effective alternative. It provides a stability point, helps distribute body weight, and offers safety when standing up. During cleaning, it's common for a person to lean too far forward in order to reach the intimate area. This movement, when done incorrectly and repeatedly, can cause lower back pain, shoulder strain, or even lead to a loss of balance. This is where long-handled hygiene tools once again become important. They allow proper reach while keeping the spine more upright, preventing unnecessary strain. A small adjustment in movement can help prevent serious consequences. Another simple and effective technique is called side hygiene. Instead of reaching from behind, the elderly person can gently lean to the side and clean themselves in a more comfortable way. This variation requires less torso rotation and tends to be safer for those with limited mobility in the spine or shoulders. It's a method that can be taught and practiced until it becomes a natural habit. It's also important to talk about the pace of movements. Rushing is a silent enemy in these moments. Every action should be done mindfully, respecting the body's limits. Practicing these movements slowly, outside of urgent situations, helps the body adapt and lowers the risk of injury in daily routines. With small adjustments in posture, support, and technique, what once seemed difficult starts to become possible again. And when someone feels they can take care of this task on their own, safely, they regain something essential: confidence in their own ability to care for themselves. Even with good techniques and assistive tools, the physical structure of the bathroom can be a deciding factor in an elderly person's safety and independence. Often, small changes in this space can make a huge difference during personal hygiene, without requiring expensive renovations or complex modifications. One of the first elements to consider is grab bars. They should be installed near the toilet at a height that allows the person to hold on firmly while sitting down or getting up. Ideally, they should be securely fixed, able to support the person's body weight without shifting. Besides offering more stability, these bars boost the elderly person's confidence. Knowing they have a solid point of support reduces the fear of falling and encourages independence. Another simple but effective safety measure is the use of non-slip mats. Strategically placed near the toilet and inside or outside the shower area, they prevent slips on wet floors, one of the most common causes of household accidents among the elderly. The ideal choice is mats with a rubber backing that stay in place easily. Bathroom lighting also plays a crucial role. Poorly lit environments increase the risk of tripping and make spatial orientation more difficult, especially at night. White light bulbs, preferably LED, offer greater clarity and visual comfort. Installing a soft night light that stays on throughout the night can be very helpful, especially for routines that involve frequent nighttime bathroom visits. Other complementary tools can also make daily routines much easier. An angled or adjustable mirror, for example, allows a person to better see their intimate area, supporting more precise hygiene, something especially helpful for women. Accessible storage items, such as baskets or wall-mounted shelves, eliminate the need to bend down or make wide movements to reach frequently used items like toilet paper, wipes, or bottles. These adaptations are affordable, easy to implement, and have a direct impact on well-being. They turn the bathroom from a risky space into one of support and care, where a person can feel safe, comfortable, and capable of performing their hygiene with dignity. Because autonomy doesn't depend only on physical strength, it also depends on an environment that respects and supports the limitations of the person using it. Donna Lucia is 78 years old. She has always been an active, independent, and stylish woman. But after hip surgery, she started having trouble doing something that used to be simple: cleaning herself after using the bathroom. At first, she tried to hide the problem from her family. She used too much toilet paper, felt pain when bending over, and began to avoid going out for fear of ending up in an embarrassing situation. The discomfort grew, and along with it came the sadness of depending on others for something so intimate. It was her daughter, Juliana, who decided to look for alternatives. With love, they adapted the bathroom by installing grab bars, adding a raised toilet seat, and getting a hygiene wand with an extended handle. Within a few days, the change was noticeable. Donna Lucia was smiling again. She started getting dressed up, going back to her morning walks, and most importantly, she regained confidence in herself. This kind of transformation might seem small to someone who's never experienced it, but for those who live it, it's huge. The autonomy she regained wasn't just physical, it was emotional, it was personal, and it all started with simple actions, guided by care and information. This story shows that with the right tools and family support, it's possible to reclaim dignity even in the most delicate moments. When an elderly person is able to clean themselves safely, the benefit goes far beyond hygiene. What's at stake is autonomy, self-esteem, and quality of life. Small changes can trigger major transformations. One of the first benefits is emotional well-being. The feeling of being able to take care of oneself, even with physical limitations, restores a sense of ability that many elderly people feel they've lost over time. This directly impacts mental health. It reduces anxiety, the fear of dependence, and even symptoms of mild depression. On the physical level, the results are also clear. Proper hygiene helps prevent urinary tract infections, irritation, rashes, and other common skin problems in people who difficulty cleaning properly can lead to a range of issues. In addition, by avoiding risky movements and using the right techniques, the risk of falling or muscle injuries is drastically reduced. Another benefit, often overlooked, is the reduction of family conflicts. When an elderly person gains more independence, caregivers feel relieved as well. The relationship becomes lighter, rooted in support rather than obligation. This strengthens the bond between everyone involved. And finally, there's the gain in personal freedom. The individual feels more confident to go out, travel, or simply go about their day peacefully, without the constant fear of facing embarrassing situations. These benefits don't come only from major interventions. They begin with knowledge, empathy, and small actions, like the ones you're learning about here. In addition to techniques and adaptations that make the process easier, it's essential to also consider skincare during intimate hygiene. Elderly skin is naturally thinner, more sensitive, and more prone to irritation, so what's used during this time makes a big difference. Avoid scented soaps, harsh antiseptics, or products with alcohol. These can cause dryness and discomfort. The best option is to choose mild pH-balanced soaps, specifically designed for the intimate area, or even baby soaps, which tend to be gentler. For those who use wet wipes, it's important to choose alcohol-free, fragrance-free, and dermatologically tested versions. Opt for hypoallergenic wipes that clean gently and do not irritate the mucous membranes or surrounding skin. Another tip is to moisturize the external intimate area, especially for women going through menopause or post-menopause, who often experience dryness. A soothing cream with chamomile or aloe vera can help prevent itching, burning, or discomfort. In cases where diapers or absorbent pads are used frequently, pay extra attention. Change them whenever they become damp and clean the area carefully between changes. This helps prevent rashes, infections, and unpleasant odors. And remember, gentle hygiene doesn't mean superficial hygiene. The key is to care attentively, without being harsh, turning an intimate moment into an act of kindness toward one's own body. Caring for hygiene is also a way to preserve health, comfort, and self-respect. Small conscious choices make all the difference in everyday life. Even with the best intentions, it's common to make mistakes during intimate hygiene that can harm health and cause discomfort, especially in older age when the body requires gentler care. One of the most frequent mistakes is the excessive use of toilet paper. Many people believe that the more paper they use, the cleaner they'll be. But this can irritate the skin, cause friction, and even leave behind residue that increases the risk of infections. When possible, choose to clean with water or appropriate wet wipes instead. Another dangerous mistake is leaning too far forward to reach the intimate area, especially without support. This movement can lead to lower back pain or falls. Using long-handled tools and side movement techniques, as discussed earlier, helps avoid unnecessary strain. Also, avoid using inappropriate products like regular soaps, harsh disinfectants, or overly scented wipes. These can cause allergies or disrupt the skin's natural pH, increasing the risk of fungal or bacterial infections. Finally, one silent but very common mistake: ignoring small signs of discomfort. Burning, itching, or frequent irritation are not normal. They're the body's way of signaling that something needs to change. Correcting these habits is simple, and it prevents serious problems in the future. Proper hygiene is not just a routine, it's an act of care and respect for one's own dignity. If these tips were helpful for you or someone you care for, take a moment to like this video and subscribe to the channel. Here, every week you'll find practical and compassionate content that helps improve quality of life in old age, with respect, empathy, and clear information. Share this video with someone who might be facing this challenge in silence. Often, a simple gesture like this can bring comfort and dignity to someone who truly needs it. And if you'd like to keep up with our guidance, activate the notification bell so you don't miss any new content. You're always welcome here. Caring for yourself or someone you love starts with quality information, and we're here to walk alongside you, step by step. Before we wrap up, I have a special invitation for you. Share in the comments which of these tips you plan to try first, or if you're already using some of these solutions in your daily life. Your experience could help others going through the same challenges. If you're a caregiver, a son or daughter, or a healthcare professional, leave your story too. Sometimes, a simple comment can open doors and offer comfort to someone who feels alone in the face of a delicate reality like this. Caring for intimate hygiene in old age goes far beyond just staying clean. It's about reclaiming autonomy, strengthening self-esteem, and keeping the connection with one's own body alive. Small choices, like adapting the bathroom or switching the type of soap, have the power to restore the dignity that no age should ever take away. If you've made it this far, it means you care about yourself or someone you love. And that, in itself, is an act of courage and love. Let this video be a starting point for a life with more ease, more confidence, and more independence. And remember, it's never too late to adapt, improve, and transform daily care into something more humane and respectful. See you in the next video. Until then, take care and be kind to yourself.